My name is Ai-Ling Lin. I am the principal investigator in the Lin Brain Lab, and I am an assistant professor in the Sanders Brown Center on Aging and the Department of Pharmacology and Nutritional Sciences in the University of Kentucky. I came from Taiwan. I grew up in a city in Taichung, a city in the central part of Taiwan. And my parents are missionaries, and I have one sister and one brother. We travel a lot with our parents to visit people in their homes, in hospitals, and in the churches. So this helped develop my passion, compassion for mankind and humanity at a very early age. I decided to pursue science when I was in junior high. I was inspired by Isaac Newton and Albert Einstein because I was so fascinated by how they can use simple equations to describe how things work and the beauty of the universe. So I was hoping one day I could be like a physicist or a mathematician like them. I was so lucky to be able to admit to the National Yangming University in Taipei, Taiwan, where I had my major in radiological sciences and biomedical imaging. And this couldn't be better for me because it combines all these areas, including physics, mathematics, biochemistry, biology, physiology, and medicine. So after college, because inspiration of my parents, I decided to do missionary as well. So I went to Bible training for 2 years. There I met my husband and we got married. Now we have 2 boys. And shortly after our wedding, we came to the United States because I went to graduate school in the University of Texas Health Science Center in San Antonio to further pursue radiological sciences. And now this time with emphasis on neuroimaging. One of the reasons I come to UK is that because UK has ability and resources to do translational neuroimaging research. And here we have very strong clinical trials going on, especially Alzheimer's Disease Center of UK is one of the 27 centers funded by NIH. So this is very attractive because I don't want just to do animal work. I want to translate all these findings into human clinical trial and to make real impact in patients and in healthcare. My long-term goal is that I can find a way to do personalized medicine for each individual. So what we are trying to do is build up a database. Even from animal models or clinical trials, we can identify patterns in each individual. So when in the future, we can give them suggestions based on their genetic background, how to live longer, live healthier, and we can monitor these changes with neuroimaging and even with cognitive testing. So our goal is that we can identify effective interventions to slow down brain aging and prevent dementia, such as Alzheimer's disease. We are using rapamycin, which is an FDA-approved drug that can shown to extend longevity and also reduce neuropathology in many cases. So that's one of the treatment we have. The other one is very cool. We use different levels of nutritional intervention. And we want to see how diet can impact our cognition and to make us healthier, smarter, and better memory. So we're using imaging to identify the treatment efficacy of these 2 interventions, and we do behavior tests to see how this impact the animal's memory and learning ability. I am glad to have strong support from the family. So on the personal wise, my husband gives me strong support, and I also can teach science to my kids. That's really nice. And professionally, of course, for me, I think doing research is more like putting all the puzzles together. So you need to find the right piece and put it in the right place. That's really challenging. And sometimes asking the right questions and find the right answers for that question is also very challenging. This lab, this team is just like a family, and we care for one another, but at the same time, we learn from each other. Each one of us have their own strength and talent. So we learn from each other, we challenge each other, and in the meantime, we also support one another. So in the end of the day, we had a lot of fun.